Introduction. Our bodies are designed to move. But how do we move? What supports our bodies? How do we stay balanced? Bones support our bodies and give them a structure. Our bones work together with our muscles, which attach to the bones and provide the power to move our bodies. Each part of our body can move, but there is a limit to how far and in what direction it can move. There are movements we want to make and movements we don't want to make. We all have our own distinct way of moving, and it's as recognizable as our faces. Our movements and balance change from when we're small right through to when we are older. Our movements also change because of illness or disease. If we move too far or too fast, or don't move enough, our bodies can be badly affected. Understanding human movement helps us understand how our bodies work, which helps our clients and helps us. In our work, we need to know the normal range of movements for our clients' safety and our own safety, so we do not hurt them or ourselves. When we understand human movement, it also helps us to communicate with clients, their carers and co-workers about their movement. Basic skeletal system. The skeleton is made up of different sized and shaped bones, which give our bodies a framework, a structure. It supports the body, protects internal organs, and allows us to move. A typical adult has 206 bones. The skeleton is made up of different groups of bones. There is the skull, which completely surrounds and protects the brain. The spine, which holds up the skull and runs down the centre of the back. The rib cage, which protects the heart, lungs and other organs. Over half of the bones in the body are in our arms, hands, legs and feet. The arm and hand bones hang from a bony crossbar called the pectoral girdle. The leg and feet bones hang from a ring of bone called the pelvic girdle. Bone shapes. Each bone has the right shape, size and strength for the job it has to do, and all the bones fit together perfectly. There are 5 main bone shapes. Long bones, which are long and quite straight. They have 2 wider ends, like these bones in our legs and arms. Short bones, which are small and shaped like a cube. These short bones can slide past each other so the joints can move easily and be flexible. Flat bones are thin, flat and slightly curved. They are strong and protect parts of the body. Irregular bones have unusual shapes, and they come in lots of different shapes and sizes. Sesamoid bones are slightly round in shape. The spine. The backbone is also called the spine. It starts at the skull and ends at the tailbone. The bones that make up the spine are called vertebrae. There is a hole in the middle of each vertebra, and the spinal cord runs through each hole. The vertebrae protect the spinal cord. Discs of tough, fibrous material separate each vertebra, and they help the spine move. They also act like shock absorbers. The bottom part of the spine joins with the pelvis, and this forms the pelvic girdle. The pelvis is a strong, irregular bone which protects internal organs in the lower abdomen and also helps support the upper parts of our body. The ribs. There are 12 pairs of ribs. The top 7 pairs of ribs are called true ribs. They are connected to the sternum, the flat bone at the front of the chest. The next 3 pairs are called false ribs. They are a bit shorter and are attached to the lowest true rib. The last 2 sets of ribs are the smallest and are called floating ribs. They are connected to the spine at the back, but nothing at the front. That's why they're called floating ribs. Ribs protect the lungs and heart and contribute to the movements of breathing and coughing. The shoulders. At the back of the rib cage is the shoulder blade, also called the scapula. At the front of the rib cage is the collarbone, also called the clavicle. The shoulder blade and collarbone meet together to help form the shoulder joint. These bones work together to help the arm move. The arms. We do many things with our arms. Each arm has 3 bones. The bone in the upper arm is called the humerus. It fits into the shoulder socket at one end and the elbow joint at the other end. In the forearm there are 2 bones, the radius and the ulna. They work together to allow the forearm to twist. The humerus and ulna connect to allow bending and straightening at the elbow. The hands. Each hand has 27 bones. In the wrist, the palm, the fingers, and the thumb. The legs. Legs have 4 bones. The longest and strongest bone in the body is the thigh bone. The thigh bone is also called the femur. The kneecap protects the knee joint. The kneecap is also called the patella. The shin bone is connected to the thigh bone behind the kneecap. The shin bone is also called the tibia. There is a thinner bone next to the tibia. It is called the fibula. The feet. The feet bear the weight of the body and help keep us balanced. The foot has 26 bones, which are in the ankle, the heel, the instep, and the toes. Sometimes when people get older, their bones might become weaker, for example, because of osteoporosis. Then they can break more easily. Joints. The places where bones meet bones are called joints. For example, the knee joint is where the thigh bone and the shin bone meet. At the joint, between the ends of the bones, there is cartilage, which keeps bones slightly separated. This stops the bones from rubbing against each other when we move. There are 3 main types of joints. Immovable joints. The bones fit together tightly and they don't move, for example, the skull. Partially movable joints, for example, the joints between your vertebrae, and the most common joints, which are called synovial joints. Synovial joints allow the body to move freely and smoothly and are in lots of places in the body. They are the most mobile and also the most prone to injury and disease. Synovial joints have a flexible covering which wraps around the joint to protect it. This is called the capsule, and every capsule is filled with synovial fluid, a lubricating fluid which allows smooth movement. The main types of synovial joints and the actions they allow are gliding joints, which allow bones to slide past each other, for example at the wrist. Saddle joints, which let the thumbs rock backwards and forwards and from side to side. Hinge joints at the elbows, knees and some of our fingers and toes allow backwards and forwards movement. The pivot joint allows turning movement, for example, head turning. Ball and socket joints at the hips and shoulders allow the greatest range of movements in the body. Condyloid joints can move from side to side or backwards and forwards, but they cannot rotate. The parts of the body that guide and support the joint's movement are ligaments, tendons and cartilage. Ligaments connect the bones together and keep them in place. Tendons connect muscle to bone. Cartilage stops the ends of the bones from rubbing together. Healthy working joints and the surrounding ligaments, tendons and cartilages are essential to normal movement. Basic muscular system. Bones cannot move by themselves. They need muscles to pull them and cause movement. There are over 600 major muscles in the human body, and they all belong to 3 types of muscles. Skeletal muscles move our bones. We can control these muscles. Smooth muscles are in the blood vessels, intestines, stomach and other organs. They keep things moving on the inside of our bodies. We cannot control these muscles. The third muscle is the heart. This is called the cardiac muscle, and we also cannot control this muscle. The main muscles in human movement are skeletal muscles. They move the bones, our skeleton. The muscle is the meaty bit and provides the power for movement. Muscles come in lots of different sizes and shapes. Skeletal muscles are attached to the bone and cross from one side of the joint to the other. At each end of the muscle there is a tendon, which connects the muscle to the bone. Muscles do 2 things. They contract and relax. Muscles get shorter and thicker when they contract. When muscles relax, they get longer. When we want to move a bone, we contract our muscles. The muscle then pulls the bone it is connected to, and the bone moves. Muscles also help us control our movements. And muscles also help us keep our balance and prevent us from falling over. When we are younger, we have less muscle strength and control, so we need help to do certain things. If we don't use our muscles regularly, they will get weak, and it will be harder to do everyday tasks. Muscles can also shorten and get stiff if they are not used, and this means our joints and limbs cannot move freely. If one set of muscles is not working properly, we can't do certain things. Healthy muscles all work together. Healthy movement is also necessary for a healthy nervous system.
What about this one for change?
The nervous system controls all the movements of our body. So if the nervous system is damaged, it affects the strength and control of muscles. Planes of movement. Our bones and joints and muscles work together in different ways, which decide how far and in what direction we move. Different parts of our body can move forwards, backwards, side to side, or rotate. And normally, we just move without thinking. To understand human movement, we need to know about the planes of human movement. Imagine a piece of paper cuts through the centre of a body and creates a left half and a right half. This is called the sagittal plane. Then separates the front and back. This is called the frontal plane. Then cuts across the body to divide it into top and bottom. This is called the transverse plane. It's easy to just think of the planes dividing the body as left and right, front and back, or upper and lower. Each plane of the body relates to particular movements of the body. Moving in the sagittal plane means front to back or back to front movements. Frontal plane movement is left to right or right to left. When we move in the transverse plane, we rotate. An axis is a point around which an object moves. An axis can be vertical or it can be horizontal. When we move, we usually combine movements in more than one plane and around more than one axis. Name that move. When we understand the basics of normal human movement, it helps in our work. This knowledge will make us more aware of any changes in our clients' movements. Every day when we move, we combine many of the following actions. The main movements of the human body are flexion, which is bending, extension, which is straightening, lateral flexion is bending the body sideways. Abduction is moving a limb away from the body. Adduction is moving a limb back to the body. Rotation is the turning movements of the body or limbs. There are 4 types of rotation. Internal rotation is when the limbs turn in. External rotation is when the limbs turn out. Left rotation, turn to the left. Right rotation, turn to the right. Circumduction is moving the limb around in a circle. Pronation is turning the palm down. Supination is the opposite, turning the palm up. Radial deviation is bending the wrist sideways towards the thumb, which moves the thumb closer to the forearm. Ulnar deviation is moving the wrist sideways towards the little finger, so the little finger moves closer to the forearm. Plantar flexion is pointing the foot down. Dorsiflexion is pulling the foot back up. Inversion, turn the sole of the foot in. Eversion, turn the sole of the foot out. Protraction. retraction, elevation, depression, horizontal flexion, horizontal extension, opposition, how we move every day is usually a combination of these movements. Range of movement is how far a joint can move. It's important that we understand flexibility and movement restrictions and the impact this has on our clients and ourselves. Injury or disease can make this range of motion smaller and the ability to do everyday tasks harder. If we don't move, our joints will stiffen and the muscles get smaller and weaker. Move it or lose it. There are 3 range of motion exercises which aim to gently increase the range of motion. In the passive range of motion, a person or equipment moves the joint through a range of motion and there is no input from the client. In the active range of motion, the client moves the joint without any other assistance. In the assisted active range of motion, the client uses the muscles surrounding the joint with some help from a worker and maybe also some equipment.
Push down a bit harder and relax. Well done.
Principles of biomechanics. Biomechanics is the action of outside forces on the body. There are a number of forces which affect the way a person moves and also their balance. For example, muscles pulling on the bone to create movement, being pushed or being pulled, gravity or buoyancy. Some things can make movements harder or easier, such as pulleys or levers. Forces can affect moving bodies and non-moving bodies.
Okay, it's ready. There.
The centre of gravity is the point around which a body's weight is equally balanced in all directions. In a standing person, this point sits approximately in the middle of the pelvis. The centre of gravity shifts when we move. The base of support is the area where the body or an object meets the floor. The bigger the base of support, the more stable the object. Where the centre of gravity is in relation to the base of support helps determine a person's or an object's stability. Near the centre, most stable. Near the edge, least stable. Outside the base, we may fall over, unless we do something about it. If an external weight is applied to the body alignment changes and shifts the centre of gravity in relation to the base of support. How close we hold things to our body affects the amount of effort that we need to support or move a load. When we hold things closer to our body, it reduces the load on the muscles around the spine and makes us more stable. When we hold things away from our body, it increases the load on the muscles around the spine and we are less stable. When we sit, there is a lower centre of gravity and so we are more stable. When we stand upright and then move, we are less stable because the centre of gravity is higher and the base of support is smaller. If the centre of gravity becomes too high, we will be less stable and more easily fall over. When we move, we are constantly making adjustments to change our centre of gravity and our base of support so that we can keep our balance. Other words. These are some of the words that health professionals use. We need to know them and have a basic understanding of them so we can do our work as well as possible.
And gradually your knuckles.
The body is broken into two parts. The axial part. This is the head, neck and trunk. And the limbs. Anterior is the front of the body. Posterior is the back of the body. Superior is the upper part. Inferior is the lower part. Medial means towards the midline of the body. Lateral means moving away from the midline of the body. Proximal means closer to the trunk of the body. Distal means further from the trunk of the body. Superficial means closer to the surface of the body. Deep means further inside the body. Dorsum means the back of the hand or the top of the foot. Palmar means the palm of the hand. Plantar is the sole of the foot. Concentric contraction is when muscles shorten. Eccentric contraction is when muscles lengthen while still controlling movement. Isometric contraction is when muscles hold a body part still. Understanding these words and actions will help you communicate with clients and colleagues. And this will help to ensure that you are working in the right way with your clients.